Hey, how's it going? We are ready for yoga for runners. Right, so let's get this started with a bit of cross-legged first. Just like to start steady and slow and just pay attention to what you feel right now. Just in this very moment, what is your body telling you about the shape that you are in? And I am just sat. I want you to just think about your posture and let it fall apart a little bit, which means you slouch. Slouching gets a bad name, gets a bad rep, but really it's just efficiency. It's just an efficient shape that we can make. That's not to say that you should just sit on your sofa and let your body just morph into the shape of whatever seat you're sat on, but we can use this to kind of start from zero to be at the most efficient place we could possibly be while you are just sat. And then get into breathing with your rib cage to expand and then draw back in from the diaphragm, from the ribs. And anything that comes out of here, anything that happens at your face is secondary to what's happening down here. And then start shifting a little bit. So you can scrunch up the side of your belly on one side, scrunch up the side of your belly on the other. And think about the relationship between your ribs and your pelvis. So your pelvis is staying still because it's sat down. But as you tilt your rib cage side to side, does that have any effect on your foundations? On the pieces of you that are touching the floor? Does your weight go all into one of your hips or one of your bum cheeks? What can you do to control and just see how a nice easy side bend could possibly feel? Very good. Alright, and then start sitting up tall and try and find what people deem as good posture. And it's no better than slouching, it's just an option, is to be able to be tall and see if you can keep your torso tall and still invite in this little side bend. Through this whole yoga class, I want you to keep breathing, but breathe less. So shorter breaths, slower breaths, so that you're not gulping in air and you're also not doing Valsalva maneuver, which is to lock out your breath. Don't squeeze that throat closed in here. Just try and keep your airways open, breathe through your nose. Try and limit the amount of mouth breathing that you do. And just kind of be slow and steady. So we're going to start this yoga class from the ground up and work on our feet and ankles and the muscles in our foot first. So I want you to sit with one leg tucked under and one leg flat like this, and pick your heel up and see if you can make a fist with your toes and then spread and splay. Make a fist, spread and splay. And think about what it feels like to use all of the muscles in your foot to make that fist with your feet, and then open fist, open fist, open. Work this out. And just give this a good little play around, and then we're going to work on giving this foot a little bit of resistance, something to think about. So then I'm going to bring your foot flat and just lift up your big toe with your fingers and just hold it up. And see if you can keep the little toes down. You can use your hand to help. So it's little toes down, big toe up, and just maintain that. And see if you can get a bit of a stretch here. See if you can keep the big toe up, little toes down. Hold this stretch. Maybe open this big toe out so it comes out to the side a little bit so we can get the width of our foot. And then give yourself something to push against. So with your hand holding that big toe, can you press your big toe into your hand like you're trying to press your big toe back down towards the floor? You're just going to activate those big toe muscles, and then when you let go, you leave your big toe up, little toes down. Give yourself another little pull. And then we take your hand away. How much of that can you earn? And then add it back in again. How much of that can you earn? And then add it back in. And then let's see that. Make a fist, spread them out, make a fist and spread them out. That big toe should feel pretty tired there. We did about 3 or 4 goes there, trying to find end range. We did a bit of pushing away, we did a bit of pulling towards you. It's an exploration of what your foot is capable of, not you trying to snap your big toe off. It's good to give yourself a little bit of resistance and see what your body can work with, but it is just an assessment of yourself to see how that feels. We're going to see how that feels on our feet in a minute. Let's do this other foot first. So start making a fist, spread and splay, make a fist, spread and splay. So you curl those toes right under and see if you can squeeze these foot muscles. I think you'll be maybe a bit surprised about how your feet feel when we start communicating with the floor when we're up on our feet and looking at the strength of our legs and balance and mobility, because it all starts with our foundations, always, the way our feet perform through the floor. Okay, so then bring this foot flat, 2 fingers, 3 fingers, pull that big toe back and just hold yourself in a bit of passive stretch just through the big toe and see if we can keep little toes down as you pull back on that big toe. And then give yourself a little push. So you try and push your toes into your hand, your hand's holding it up. And then fade it out back to passive stretch. Push again, and then fade it out. And I've got my big toe roughly at about 90 degrees. If your big toe does not like 90 degrees, I'm absolutely happy for you to barely have that big toe off the floor, just at a shape that you can connect to, a shape that you can perform from, and you'll be alright. Keep yourself nice and safe and injury free by not snapping it off with your hand. And let's see what happens if you just pull that back. Can you keep that big toe up? Pull it back again. How much of that flexibility of the toe do you earn separately? That's it. Let's go last one. Pull it back, maybe open a little bit out to the side, and we pull back. And then let's see, get a bit more action and movement back into this foot. Make fists, spread them out, make fists, spread them out. And you can assess yourself. If you do this, and after you're done, you're like, that was terrible. My big toe hurts now, or my foot hurts, or something's terrible. It might mean that you might not be good for doing that. However, I would ask yourself to really think about, could you just dial it down a bit? Could you show yourself just enough action to get away with it and to improve? Okay, so let's look at this foot up on our feet. So when you stand up, let's see if you can tip yourself over whatever foot you did first, whatever foot you were bending that toe with first, tip yourself over that foot and try and open your pelvis up. So my foot is pointing this way towards the end of my mat. I'm going to try and show the pelvis to the camera. So that's open pelvis, and just see if you can tip yourself over and push yourself back using your toes. Tip yourself over, push yourself back using your toes. And then can you ride this open pelvis balance with your weight tipping? If you drew a line down from my nose, it would be in front of my foot a bit, I think. You tell me. But I think it is. I think I'm tipping over my pelvis. It's coming quite far forwards, like that. And then let's see, can you rotate your pelvis around, then rotate it back. Rotate your pelvis around, rotate it back. And the weight stays on your forefoot. This should be kind of exhausting, should be kind of tiring. And see, how does that big toe play with maintaining your balance? And I'm still trying my best to keep my weight tipped this way. That's it. Very good. Okay, and then let's try that on the other foot. So start with the pelvis open. I'm going to turn this way so you can see me. So pelvis open, tip yourself over and feel the weight tip into your forefoot. Keep that open, keep tipping over, and see if you can ride that balance, and then use the strength of your forefoot to push you back. Find the brink of this, and then use the strength of your forefoot to push you back. Let's go last couple. We're looking at using and paying attention to the way that your foot performs with keeping you in balance. I quite like this open position. There's something about this that I feel in equilibrium with this floaty leg behind me, my head going this way. They're counterbalances against each other, and I think I can play with that quite well. And I'm quite happy to show you that and maybe start you off here and see how that feels in your body. And then let's see if you can rotate the pelvis around and back, around and back. I realise that I'm very close to the wall, so I can cheat a little bit and give myself a little touch of the wall to kind of regain a little bit of confidence. And I'm all for that. If you're close to furniture or something that you can hold on to, use it. Just make it feel nice, make it feel like you're doing a good job of showing this pelvis that can turn in balance. Very nice. Okay, and then let's test this foot and toe mobility. So if you go, whatever foot you balanced on first goes behind you now. I want you to bend both knees until that back heel wants to pick up, just because of the angle of this ankle. So if you look at my shin is in a positive angle, it's leaning over, and then see if you can lift up your heel and drop it back down. Lift up the heel and drop it back down. Whichever way your knee points changes what shape your foot makes. So if your knee comes into your midline, the way it goes through your big toe. If your knee goes out, the way it goes towards your little toe. Knee comes right down the middle, we do a bit of a shared function of that foot. And that changes all of the stuff in the ankle, the way the metatarsals perform, everything, depending on where this angle goes. And this is kind of hard on this standing hip as well, on the foot that you're keeping still. Just pay attention to this and work out how that feels. Very nice. Cool. And then swap legs. Let's see this back foot behind you. Get this shin into a positive angle. So you're trying to get your shin or your knee as far forwards as you can, and your shin tipped over forwards as far as it can go. And can you maintain that as you lift the heel, sink it back down, lift the heel, sink it back down. And this is really to make the toes perform. If you feel like your toes want to make a bit of a claw and kind of curl under your foot, that's the thing that I think I'd like to teach you out of the most, really, that your toes can stay kind of pressed into the floor naturally without doing an action. It's a bit like they are part of the team, but they let you travel over those toes. And maybe you can see in the video how that translates into shape of toes just being a passive part of this. Knee comes into midline, knee comes right down the middle of your foot to the outside, and kind of identify how happy you are with all of those shapes, because that knee to the outside, I feel a little bit vulnerable in terms of strength or balance, that my hip and my foot wants to collapse that way. I could do with training that more. So I've identified that in showing you. I can feel what's going on in my body. I want you to ask yourself those same kind of questions. Very nice. Okay, then pick yourself up, and then let's a little bit of understanding our hamstrings, also with our lower back. So I've got a block here. If you want to use a cushion or anything that can just make half kneeling feel pretty comfortable. So you've got one knee here and your front leg quite far in front, so the foot's a bit further forwards than this front knee. And then put your hand onto your lower back and see if we can do a pelvic tilt. Now, in the orientation of our pelvis, it's in extension, which is like this, when our lower back arches and the coccyx kind of tries to come out from under the bum. That's extension. It's flexion, and we tuck tailbone under the bum. As you tuck tailbone under, you might get a little stretch here, and this gets a bit shorter, the hamstring on the front leg. And when we go the other way, hamstring lengthens, this gets shorter. We're kind of playing off of the leg behind us to the leg in front of us. And if we're going to think about running and walking and locomotion, even riding a bike, we are in this cycle of one leg in front, the other leg goes in front. One leg's behind, the other leg goes behind. It cycles. And this orientation of our pelvis is a big part in that. And it dictates stuff through this hip stuff, this hamstring. And for now, we're just looking at the orientation of the pelvis. Now I'm going to look at this for a hamstring stretch. So can you straighten this leg a bit? Try not to have your knee locked out. Give yourself a bit of space so this knee has a little bend in it, and then see, as you arch your back, does that invite in a nice hamstring stretch in the belly of the muscle, right in the meaty bit where this muscle is the thickest. So not at the attachment points, which is behind the knee and under the pelvis at the ischial tuberosity. I want you to feel it here, right here. And it might mean that as you arch your back, maybe you tip your pelvis over and then tuck tailbone back under. This should be pretty exhausting, but I want you to feel this journey into stretch and back out of it, into stretch, back out of it. And you can then start finding where your comfortable stretch is, where you feel it, and it feels like nice exercise and not like an angry connective tissue pull or a nervy pull. So if we tip our pelvis out, I'm going to use the wall a little bit. You can use furniture, or you could have another yoga block here to help you out, but just find that stretch that feels nice. And I'm being kind of conservative about this really, and holding myself to just barely feeling that stretch. I'm quite happy to tip myself further, and if I wanted my hands to the floor, it becomes an expression of my spine along with hamstring. Let's just keep this to just hamstring, because we could go to this look with my palms on the floor, and it's still a very nice stretch for me, but I've done stuff way up here. I want you to just identify just hamstring, so we can send our brain to it and think about it. It's not the only way. Don't only do this. This is just for us to really pay attention. And then see if you can drive your heel down and connect. I nearly fell over. So you can drive your heel down, connect to this hamstring, and use that push to tip your pelvis the right way up, and then find stretch again. And then use that push to tip pelvis the right way up. I'm just going to do one more. So it's 3 good goes at connecting to this hamstring under a little bit of tension, under a bit of fatigue. Very nice. Let's swap legs. Stay facing this way so you get a different view of this. So we start with just pelvic tilt. So this foot goes just a little bit in front of the knee, tuck tailbone under and arch, tuck tailbone under and arch. And it's a little bit of find it, lose it. See if you can identify feelings in your body. And those feelings will depend on how flexible you are. I'm medium flexible for a yoga teacher, probably not very flexible, but I'm more bendy than your average 43-year-old, which I am at this date. So, can you tuck tailbone under? What does this thigh tell you about end range stuff as you change the orientation of the pelvis? And then when you arch, do you get any feedback from this hamstring? I don't so much. You might, depending on if this hamstring is feeling pretty tight as you arch your back, it might influence the length of this enough that your body tells you it's influenced it. But if you put your hand here, I can feel it. I can feel it changing. It just doesn't travel as far as stretch for me in this shape. So let's see if we straighten this leg out. Remember, I'm not so keen on having a locked knee for this today. I just want you to have a little bend and then find this flexion to extension of the lower back, and then tip yourself over. So see how my chest starts leaning forwards. There's my stretch there, and then as a tuck back away. There's my stretch there, and then tuck back away. So enter, stretch, exit, enter it, exit, and then just see if you can find that stretch and hold. Just hover over that a little bit, and then we'll feel the stretch in the belly of the muscle. So we're really talking about this bit here. If you feel it pokey behind the knee, feels like the edge of pins and needles, we are maybe stretching that nerve, and it might help to point your toes away a little bit. It might help to have your knee bent a little bit more, but it is still coming from the length between these 2 points, which means if you pull the pelvis into more of a tilt and the coccyx tips out from under your bum more, that is lengthening these tissues here, and that is it. Remember, we said we could do a bit more of a big global stretch down the whole back of our body, involving our spine, to get palms down, and you can play and try that if you like, but I want you to just feel as much isolated individual hamstring stuff as you can, and then start driving your heel down and use that push to tip your pelvis the right way up, and then tip back over into stretch, tip the pelvis the right way up, and then tip back over into stretch, and feel this hamstring lengthen as the hamstring lengthens. That's a terrible sentence. And then feel the hamstring contract to tip the pelvis the right way up. Feel the hamstring lengthen as you tip the pelvis over, is what I meant to say last time. And then use this hamstring to contract and pull you back. Just 3 good goes. Very nice. Okay, and then if you bring yourself down, back onto your mat again, into 90-90. So we've got right leg forwards, left leg back, like this. It's called 90-90 because of the 90-degree angles. And hop forwards your hand that you're posted on. So I've got my left knee here. This is my left hand that's on the floor. And I'm going to try and still understand this tipping of the pelvis. When you tip the pelvis over, that stretches into the glute, into the piriformis. That is where the action is. And then you tip your pelvis back the right way up. Let's just do 3 goes at that. See if you can make this stretch in your left glute, if this is your left leg, underneath your chest, that comes from you tipping your pelvis over and not coming from you rounding your back. So let's try that. If you just drop your nose down towards your knee, pick yourself back up. That wasn't an action of the hip, that was an expression of your thoracic spine curling over and picking back up. So last go, tip this pelvis over, and this time, see if you can hold this stretch. I'm going to bring this block in, just because it's comfy for me to just drop my elbow here. I'm going to tease this pelvic tilt in more to see if I can understand this stretch in my left glute even better. Just hold, keep tipping the pelvis over. And this should just be passive stretch. So you are just hanging, and that's enough to just hang. And let your body tell you the feedback about the things that you feel. And that is it. It should be kind of nice. And then just start giving yourself a little push. So if you drive down this right knee, how does that feel? You fade it out, back to passive stretch. You tease yourself more into this pelvic tilt more. So I don't know if you can tell from the video, but the more I tilt myself in stretch, the more the outside of my left hip, my left glute, peels off the floor around here. And then use the push of your knee to tip your pelvis the right way up. And then drop yourself back into it. Use the push to tip you up, and then drop yourself back into it. Very good. Let's go a couple more. Amazing. Very good. And then we want to try and earn that strength. So are you as strong as you are flexible? Let's see if we can get towards that. So it's by lifting this knee up towards your chest. So hands either side of your thigh, lift up your knee, and then see if you can float this front foot and squeeze the knee up towards your chest. And maybe bring your knee out, so bring it towards camera, away from the camera, towards the camera, away from the camera, and trying to keep this foot nice and floaty. So I'm trying to train this stuff on the inside of my hip to be as strong as I am flexible. And then drop, stretch again. Perfect. Alright, and then swap legs. So I'll keep facing this way and you get to see it from this different angle. So right leg goes under my chest, left leg walks back, and we're in 90-90, so 90-degree angle here, 90-degree angle here, and this left hand posted up. So can you grab hold of this pelvis and just see if you can tip yourself over again, and then tip yourself the right way up. And try and practice understanding that pelvic tilt that makes the stretch happen in your right glute, in your right hip. And then tip over. You can bring in a block or a cushion or something to maybe drop your elbow down. And see if we can tease ourselves into this passive stretch just a bit further. Check in with your breathing and how your body is talking to you, what kind of vocabulary is happening in your brain. If you work like that, if that's the way that you think about things, do you hear words? Do you feel like your body telling you that's a big stretch, that's a lot, or is it you've got to search for it? Or maybe your body and your brain tries to distract you and be like, why don't you just move on a bit? Why don't you change things? Why don't you try something else? Or what are you going to do next? How far are you going to run? Something like that. And then my advice is to just tune in to what's happening right now and listen to your body. Listen to that stretch. Ask yourself, can you get any further into it? Is there any more pelvic tilt that you could tease out of this? And then start pushing your right knee into the floor, or whatever leg you've got underneath your chest. That is the one that pushes into the floor. So we feel the connection into the glute, into the outside of the hip, and then use that to pick you up, and tip back forwards again. Use the push, pick you up, tip back forwards again. What does that feel like? How does that feel to use the strength of the stretching tissue to tip the pelvis over, tip it the right way up? Remember, this is different to you dropping your face, picking your face up. Very nice. Amazing. And then let's own this. So you try your best to lift up this front foot and own this stretch. So can you get the foot off the floor? You can lean back to get this, but the goal is to make this closing angle yours. Bring your knee out, bring your knee in, bring your knee out, bring your knee in. So kind of exploring where this hip could go. Own this strength. Very good. And then drop back down again. So with all of this talk of pelvic tilt in some different orientations, let's look at that from all fours. So push your chest high, and can you make your lower back segment, so it goes coccyx into L5, L4, L3, L2, L1, and then reverse it back that same way. So it goes coccyx, L5, 4, 3, 2, 1, and then 1, 2, 3, 4, 5. And who's to know that that's really happening, but we can still try, still send your brain to that stuff and work out how you're making that work. Can you make that work? What does your body say about trying to be specific about lower back? It's got to come from the muscles in your belly. Very nice. Okay. And then let's do a little bit of shoulder and thoracic spine stuff. So if you're happy, sit on your feet like this with your toes pointing backwards, this will be nice. If this position doesn't work for you, you can sit onto your bum, go cross-legged, but whatever position feels good for you to get into some shoulder stuff. And I want it to be opposite. I'm going to face you actually to show you this. So can you go hands like this? So show me your palms, make a fist in your left hand, and then scrunch up everything on this right side as you pick up your left and squeeze yourself into side bend. My bum's kind of shifted across, and I'm going to let it. And just how much can you close one side, open the other, and then can you do the same on the other side. I'm going to hold this kind of for a short amount of time first and then build it up. I want you to pay attention to the closing side the most, which is closed fist, closed elbow, closed armpit, closed rib cage to pelvis. And the other side goes open hand, open elbow, open armpit, open rib cage to pelvis. Then do the same on the other side. And the breathing is important here, because it might be tempting to go huh, every time you hit end range. See if you can breathe in a way that keeps you down regulated and kind of happy with feeling this stuff. So go close to open, close to open. And then think about the opening side now. Can you move this shoulder blade? Do a shrug, scrunch down, shrug, scrunch down. So the shoulder blade is sliding on the rib cage while you're in side bend. And go the other side. Shrug, shrug, shrug. And we're also, because we're kneeling sat on our feet, if you could manage this position, you could even do this standing as well, really. But because we are sat on our feet, there's the ankles are getting stretched back behind you like that. I'm going to finish off in a second with a little downward facing dog, so we can have a look at moving the feet, moving the ankles, moving the toes before we finish up. So if you roll yourself up and spread your palms first, spread your fingers, press your fingertips into the floor, and then tip your head over and see if you can push your chest away so you've got shoulder blades spread, tuck your toes, lift your knees, and then push hips up and back. Drop your chest through, so your chest is pushing towards your thigh, and then sink your heels towards the floor. Don't worry about if they touch or not. And then push the weight from left hand to right, drop one knee, drop the other. Play with where you put your weight, how you move the weight around on your hands into your feet. You go tiptoes to heels down, tiptoes to heels down. See how it tiptoes tips me over onto my hands, heels down, tips me back into my feet. Try and get as much weight into your feet as you can. Maybe move hips side to side. Maybe drop one knee, drop the other. Try and push legs straight. Find a little bit of possible calf head range action. And feel your pelvis heighten on one pocket, drop on the other, one pocket down, one pocket up. Then bring yourself down, bring yourself back into cross-legged. And settle. Maybe got ear to shoulder, slowly. Settle back into that nasal breathing that we started with, and relaxed posture, which might mean letting your back round a little bit. And that's that little bit of action and a tiny bit of inversion from the downward facing dog. Feel stuff. Feel where the blood might have rushed to your head a little bit. Feel your heart rate possibly drop a little bit. See if you can go to down regulation, slower breathing, relaxed jaw, relaxed forehead, passive posture. Might be nice to sit up tall, but it's certainly more calming to let your body just be efficient. Yes. That is us. Thank you so much for hanging out. Namaste. Let me know when you want to hang out again. We'll do some more yoga. See you soon. Bye.